that are iliopsoas and muscles on the posterior aspect of the coxal bone where is the buttock. So these muscles are called gluteal muscles that can be divided into superficial and deep. And in the thigh, in the leg and in the foot. So the muscles of the iliac region are composed of one muscles separated into three parts. Such a muscle is called the iliopsoas muscle. Psoas means lumbar. It consists of the iliopsoas muscle consists of three parts. Iliacus, that is a flat muscles that fans towards the lesser trochanter. The psoas major, starting with the lumbar spine, and inconstant psoas minor, the shortest one, which does not enter the thigh. And so the iliacus originates from the superior two-thirds of the iliac fossa. Its superior boundary is provided by the iliac crest. So it passes in front from the anterior superior iliac spine, and posteriorly its end is on the superior posterior iliac spine. And the iliacus passes downwards, its fibers converge and taper, and finally passes in front of the hip joint and end on the lesser trochanter. The psoas major starts with the lumbar spine. It's a very important muscle consisting of two parts, superficial and deep, between which is the origin of the lumbar plexus. So the lumbar plexus is positioned between its superficial and deep parts. The superficial part starts with intervertebral discs, 5 intervertebral discs. The first one is thoracolumbar, and the final is between lumbar vertebrae 4 and 5 and adjoining parts of vertebral bodies. So this means that the superficial part forms 5 slips, between which we have just foramina, 4 lumbar vessels. The deep part starts with 5 muscle slips as well from costal processes of all lumbar vertebrae. The muscle tapers downwards and adheres to the medial aspect of the iliacus and both end on the lesser trochanter. The psoas minor, if present, starts only from the first muscle slip, superficial muscle slip, So from the thoracolumbar disc and adjacent vertebrae T12 and T1. It forms a very long silver tendon that inferiorly ends on the iliopectineus arch and pecten pubis. Here is the iliopectineal arch. It dilates such a space lateral to the iliopectineal arch, which is called the lacuna musculorum, and which transmits the femoral nerve as well. What's the function of the iliopsoas muscle? Because it passes in front of the fulcrum of the coxal joint, it must flex the hip. So if the pelvis is stabilized, the iliopsoas acts from above by flexing the hip joint. Acting from below, if we are just standing, it flexes the pelvis and the whole trunk. Apart from this, the iliopsoas rotates the femur laterally. Why? Because it ends on the trochanter minor. The trochanter minor is positioned on the posteromedial surface of the femur, and so it tends to pull the trochanter minor forwards, at the same time rotating the femur outside laterally. Extorsion. This is especially conspicuous in patients with a fractured femoral neck, and in such supine patients, the whole lower limb below the neck is rotated laterally. Apart from this, it adducts the thigh. So it's responsible for adduction of the hip joint. The iliacus is a very thick muscle. So because of this, the iliopsoas is a very strong muscle. And the psoas major is not very thick, but it's extremely long. Because of this, it's responsible for a range of movement. A short distance race depends on the iliacus because it's very strong and responsible for a wide range of movements. It's the second important flexor at the hip. The strongest flexor at the hip is the rectus femoris, and the iliopsoas is just the second one. 2. Strongly flex at the hip joint. Oh, here you can see just arches in the proximal or in the origin of the superficial part of psoas major through which pass lumbar vessels. In the gluteal region, we can distinguish 3 gluteal muscles that are superficial. So the strongest one, gluteus maximus. Deeper to it, gluteus medius. And the weakest of the 3 gluteal muscles is the gluteus minimus. So minimus is deepest in position, and the gluteus maximus is strongest, widest, and thickest. The gluteus maximus is the main extensor, the strongest extensor at the hip. It's responsible for our erect position. It's quadrilateral in shape, so its origin refers to the iliac crest, posterior plate of thoracolumbar fascia, dorsal sacroiliac ligaments, and the lateral border of sacrum and coccygeal bone. All its fibers descend laterally, most of them, and in the iliotibial tract, except for its deep lower part. So in the gluteus maximus, we can distinguish its superficial and deep part. And the deep part may be separated into superior and inferior. So nearly the whole muscle ends in the iliotibial tract, except for the deep muscle fibers of its inferior part, and the deep inferior fibers end in the femur on the gluteal tuberosity. Because of this, we can distinguish 2 completely different insertions. Insertion means distal attachment of the gluteus maximus. The bigger part ends on the iliotibial tract, while the deep inferior part ends in the gluteal tuberosity. Both the whole muscle extends at the hip joint, but all fibers ending in the iliotibial tract just abduct at the hip, abduct. And because all these fibers project above the fulcrum, most fibers of the gluteus maximus project above the fulcrum and so abduct at the hip. The inferior deep fibers that end in the gluteal tuberosity project below the fulcrum and so adduct at the hip. Apart from this, the gluteus maximus rotates the thigh laterally, so it's responsible for extorsion of the thigh. Deeper to it is the gluteus medius and gluteus minimus, both tend towards the greater trochanter, but their anterior and posterior parts are completely different in function. The anterior parts flex out the hip and rotate the femur medially, so are responsible for intorsion and flexion. Contrariwise, the posterior fibers of both the gluteus medius and minimus extend the hip, and apart from this, are responsible for extorsion, like the whole gluteus maximus. So the whole gluteus maximus and posterior parts of both the gluteus medius and minimus are responsible for extorsion of the hip joint. Because of a completely different function of their anterior and posterior parts, these two muscles are called muscles of dance. Both gluteal muscles, medius and minimus, insert above the fulcrum of the coxal joint. You should memorize that the fulcrum means the main horizontal axis passing through the very center of the hip joint, and this plane is equal with the superior border of the trochanter major. So both gluteal muscles project above it and so abduct at the hip. And how about, apart from this, we have one more muscle that refers to the gluteal part. It's called the tensor fasciae lati. The tensor fasciae lati starts with the superior anterior iliac spine and some 5 centimeters behind it. It passes downwards, being enveloped in 2 plates of the fascia lati, and afterwards it forms a very strong aponeurosis. And such an aponeurosis is conjoined with that of the gluteus maximus and gluteus medius, and together form the iliotibial tract. The iliotibial tract is a very strong aponeurosis on the lateral aspect of the thigh with 3 muscles influencing it. We can say that the iliotibial tract has 3 heads. The anterior head is tensor fasciae lati. The middle head is gluteus medius, and the strongest posterior head is provided by the gluteus maximus. This means, and the iliotibial tract inserts onto the lateral tibial condyle to Gerdy's tubercle. Gerdy's tubercle refers to the insertion of the iliotibial tract. This means that all these 3 muscles, tensor fasciae lati, gluteus medius, and maximus, influence the knee joint as well. Both stabilize the knee joint. Not both, just 3 heads, tensor fasciae lati, gluteus medius, and gluteus maximus, stabilize the knee joint. So what does it mean to stabilize the knee joint? If the knee is somewhat extended, they just make extension stronger. And if we have a flexed knee, all these 3 muscles flex it more. And just here, we can see the deep gluteal muscles that are composed of the piriformis. The piriformis looks like if an inferior continuation of the gluteus maximus, because both refer to the same plane. Just below the piriformis is gemellus superior, and below it obturator internus and gemellus inferior. The obturator internus starts on the interior of obturator membrane on the lateral pelvic wall. Afterwards, it exits the pelvic cavity through the lesser sciatic foramen and flexes laterally at right angle here. So it resembles a capital letter L with its horizontal part on the lateral pelvic wall and its vertical part that passes transversely to the trochanteric fossa. Somewhat superior, you know that the lesser sciatic notch is limited superiorly by the ischial spine and inferiorly by the ischial tuberosities. And here start the gemellus superior that starts with the ischial spine, and gemellus inferior originating from the ischial tuberosity. And these 3 muscles together with the obturator internus, insert medially to the trochanter major to the so-called trochanteric fossa. The trochanteric fossa is positioned just at the base of the trochanter major. So it projects below the fulcrum. Because of this, gemelli, two gemelli, and obturator internus and obturator externus as well, just adduct the hip. So can you see? Gluteus minimus, gluteus medius, minimus, and piriformis, and on the trochanter major, and so abduct the hip. All remaining muscles adduct the hip. So gemellus superior, obturator internus, and gemellus inferior, all three, and in the trochanteric fossa, as does the obturator externus as well. What is the obturator externus? It starts on the exterior aspect of the obturator membrane and passes in front of the quadratus femoris. So this means that the obturator externus passes in front of the quadratus femoris, which is visible here, and it ends in the same trochanteric fossa, like two gemelli and obturator internus. And the last muscle here, the lowermost, is the quadratus femoris. All these deep gluteal muscles are positioned behind the hip joint. So they must extend. They extend the hip. And just here, through the superior margin of the trochanter major, passes the fulcrum. So only the piriformis projects above the fulcrum. So the piriformis abduct the hip. All remaining muscles project below the fulcrum and so adduct the hip. So two gluteal muscles, medius and minimus, and piriformis, just abduct the hip. All remaining adduct it. As you can see, all these muscles on contraction are responsible for external rotation. External rotation. Nearly all muscles in the pelvis are external rotators. We have only 3 exceptions to this. 2 exceptions refers to anterior parts of the gluteus medius and minimus, and the 3rd exception refers to the inferior part of the adductor magnus. All remaining muscles including gluteal muscles, are responsible for extorsion. Apart from this, the obturator externus supports the femoral head and neck. So it supports both the femoral head and neck, especially when the femur is being abducted. So here is the gluteal maximus. Its greater part ends in the iliotibial tract and abducts the hip, and due to the iliotibial tract stabilizes both the hip and knee joint, and its deep part, inferior deep part, that adducts the hip. The gluteus medius and minimus are extremely important while walking, because if we are during walking, if we are standing on one foot, on the ipsilateral side, two muscles contract in order to prevent from the contralateral tilt. It's very important here. So if the whole body is supported only on one lower limb, normally the pelvis would be tilted towards the opposite side, but two gluteal muscles, medius and minimus, strongly contract to prevent from an excessive pelvic tilt towards the opposite side. All these muscles were discussed and their function. So memorize that the piriformis looks like the inferior part of the gluteus minimus. They act in a very similar way. Muscles in the thigh can be separated into three parts. So in front we have extensors. So the anterior compartment is called extensors. The posterior compartment in the thigh is a flexor compartment, and medially between anterior extensors and posterior flexors, the adductor compartment is inclined. The position of the extensors and flexors is completely different from that in the upper limb. In the upper limb, all flexors are in front and extensors behind. And in the lower limb, extensors of the thigh and leg are positioned in front, and flexors on the posterior aspect of the thigh and leg. And the posterior compartment is composed of the so-called hamstrings, 3 hamstrings. The adductor compartment comprises 5 muscles that adduct at the hip, and the anterior compartment comprises only 2 muscles, mostly the quadriceps femoris, and the second one is the sartorius. But the sartorius is a flexor. The sartorius flexes both the hip and knee joints. So in spite of belonging to the extensor compartment, it flexes both the hip and knee joints. The sartorius, of course. The biggest extensor in the thigh is the quadriceps femoris, 4-headed muscle. It has 4 heads. Its straight head has a special name, rectus femoris muscle. It starts with 2 tendons, one arising from the inferior anterior iliac spine. This is the so-called straight tendon, and the other tendon starts from the capsule of the hip joint, reflected tendon. 2 tendons, straight and reflected, join and form just a very flat aponeurosis in front of the muscle, from which start muscle fibers that pass in a bipinnate way, and all these muscle fibers end deeply in the muscle, where is a deep aponeurosis. So you can see that the rectus femoris has 2 aponeuroses. Its superior aponeurosis is in front of the muscle, where start all its muscle fibers, and the deep one is invisible, and here onto which insert all muscle fibers. Most of the deep aponeurosis forms the superficial part of the common tendon that includes the patella, and below it ends on the tibial tuberosity. Its distal part between the patella and tibial tuberosity is called the patellar ligament. Some fibers pass on both sides of the patella and are called medial and lateral patellar retinaculae. So memorize it. 2 aponeurotic plates. The superior one is just insertion, and the distal is just origin for muscle fibers, and the distal aponeurosis, aponeurotic plate, is for insertion of its muscle fibers. Apart from this, the quadriceps femoris has three vasti muscles: vastus medialis, vastus lateralis, the strongest one, and the vastus intermedius, positioned deep to the rectus femoris. Three vasti muscles: medial, intermedius, and lateral, that have deep proximal aponeurosis and deep distal aponeurosis. Most their fibers and in the common tendon, finally inserting onto the tibial tuberosity. Apart from this, you can see the second extensor of the thigh, that is the sartorius. Sartorius means a tailor. It's the longest muscle in the body that just passes spirally in front of the thigh and reaches the medial position. Superiorly, it originates from the superior anterior iliac spine and finally ends below the knee to the medial tibial condyle to form the so-called pes anzerinus superficialis, superficial goose foot. Pes anzerinus superficialis. The pes anzerinus superficialis is composed of three tendons. In the thigh, we have three different groups: anterior extensors, medial adductors, and posterior flexors, each giving one representative to the pes anzerinus superficialis. So, an representative of extensors is the sartorius. A representative of adductors is gracilis, and a representative of flexors is a semitendinosus. These three tendons are flattened and form the pes anzerinus superficialis. The anterior-most is the sartorius, sartorial tendon, the middle tendon of semitendinosus, the middle tendon of gracilis, and the most posterior is tendon of semitendinosus. As you can see, it passes spirally in front of the fulcrum of the hip, so it must flex the hip. And finally, it passes behind the fulcrum of the knee joint, so it must flex the knee joint as well. So this means that the extensor compartment all the time comprises two muscles, quadriceps and sartorius, but the only extensor of the hip is the quadriceps femoris. Four heads of the quadriceps femoris form a common tendon that extends the knee. So the quadriceps femoris is the only extensor of the knee joint. The sartorius flexes both the hip and the knee joint. The adductor compartment is arranged by 5 muscles positioned in 3 layers. So the superficial layer is composed of 3 muscles that radiate from the from the pubic bone. These are pectineus, adductor longus, and gracilis. The gracilis is the only adductor extending below the knee, and it contributes to the pes anzerinus superficialis. Somewhat deeper is the adductor brevis in the middle layer, and the deepest one is the adductor magnus. So here we can see only the superficial layer of adductors consisting of pectineus, adductor longus, and gracilis. The gracilis, of course, flexes the knee joint because the only extensor of the knee is the quadriceps femoris, all remaining flexed. These 3 muscles in the superficial layer project in front of the hip joint, so must flex the hip, and at the same time they approximate the femur towards the mid-sagittal plane. So this is just called adduction. So here we can see the superficial layer of adductors, pectineus, adductor longus, and gracilis. And deep to pectineus and adductor, just here, is positioned the adductor brevis. And the adductor magnus, the adductor brevis, and the adductor magnus is a very big muscle extending, that's triangular in shape. Its apex refers to the inferior pubic ramus, ischial ramus of ischium, and lateral aspect of the ischial tuberosity. It radiates throughout the medial lip of the linea aspera on the femur. And towards the femur, it forms 4 small foramina 4 perforating arteries that reach the posterior aspect, and one of them is bigger for the femoral artery. It's called the tendinous adductor hiatus. Here you can see the obturator externus. The obturator externus, from a developmental point of view, belongs to adductors. It projects just above the adductor brevis and is even innervated by the same nerve that innervates adductors. So on the right, we can see the superficial layer of adductors consisting of pectineus, adductor longus, and one more muscle has been removed. Here should be the gracilis. The middle layer is composed of a small adductor brevis, and the biggest adductor is the adductor magnus. Its superior part comprises muscles that pass in a transverse manner, in a horizontal manner, and this part, the uppermost part of the adductor magnus with a horizontal course of muscle fibers, is called the adductor minimus, and some of its fibers, starting from the ischial tuberosity, pass vertically to the adductor tubercle on the medial condyle of the femur. And so all these vertical fibers form the ischiocondylar part. The ischiocondylar part. What's the function of adductors? So all adductors project from the pelvis and pass downwards, some transversely, like the superior part of the adductor magnus, but they pass mostly pass laterally and inferiorly, because all adductors adduct at the hip joint. Apart from this, most of them project in front of the fulcrum, and so must flex the hip joint. This refers to the pectineus, to the superficial and middle layers, and the anterior part of the adductor magnus. The adductor magnus is a very thick muscle that projects both in front of the fulcrum and behind it. So the anterior part of it, of the adductor magnus, mostly the ischiocondylar part, extends the hip. The ischiocondylar part of the adductor magnus is a very strong extensor of the hip. The strongest is the gluteus maximus, and the second place is the second strongest extensor of the hip, the ischiocondylar part of the adductor magnus. Apart from this, most adductors so all remaining adductors just flex the hip, flex, and only the ischiocondylar part of the adductor magnus extends the hip. Most adductors are responsible for extorsion, so lateral rotation at the hip joint, and the only exception to this is the ischiocondylar part that rotates the hip medially. It's a very important thing to memorize. The ischiocondylar part of adductor magnus, together with anterior parts of the gluteus medius and minimus, rotate the hip medially, are responsible for intorsion. All remaining adductors are responsible for extorsion. The posterior muscles in the thigh that are called flexors or hamstrings all except for short head of biceps femoris, all flexors of the thigh start with the ischial tuberosity. And afterwards, these three muscles diverge. To the medial side pass semitendinosus and deep to it semimembranosus. But the long head of biceps femoris passes laterally with relation to the popliteal fossa. So in the flexor compartment of the thigh, two muscles occupy the posteromedial position, semitendinosus and semimembranosus, that pass on the medial side of the popliteal fossa, and one muscle, that is the long head of the biceps femoris, joins its short head, and a common tendon passes lateral to the popliteal fossa to insert onto the fibular head. How about the semitendinosus? The semitendinosus just participates in the superficial anserine piece, being the posterior most in position. So three muscles, three different tendons from three groups converge on the medial tibial condyle to form the pes anserinus superficialis. What's the function of all hamstrings? So, acting from below, they extend the hip. So, while standing, they extend the hip and pelvis. If the pelvis is stabilized, just they flex the knee joint. Flexion of the knee joint is genuflexion. So as you can see, all three hamstrings at the same time, so simultaneously, may extend the hip and flex the knee, genuflexion. The long head of biceps femoris tilts the pelvis backwards, while the short head tilts the pelvis forwards. Muscles in the leg are arranged in three groups: anterior extensors, posterior flexors, and lateral fibular or peroneal muscles. In the anterior extensor compartment, we have only three muscles that enter the foot: tibialis anterior is the most medial. The most lateral is extensor digitorum longus, and between both and deep to them is extensor hallucis longus. As you can see, the extensor, all these three muscles, tibialis anterior, extensor hallucis longus, and extensor digitorum longus, pass in front of the talocrural joint, and so are responsible for dorsal flexion or just dorsiflexion. The extensor hallucis longus and extensor digitorum and their central tendon ends in middle phalanges. So here, referring to toes from 2 to 5. So the central tendon each ends in the middle phalanx, but it gives us collaterals ending in the distal phalanx, like in the hand in miniature. The same, but in miniature, like in the hand. This is the so-called extensor hood. And extensor hallucis longus directly ends on the base of distal phalanx. The posterior group in the leg is composed of superficial and deep flexors. The superficial flexors consist of the gastrocnemius with two heads, medial and lateral. Both start above the knee joint from the femur. So to some extent, they flex the knee joint as well. Deep to the gastrocnemius is the soleus, starting on the posterior tibial aspect from the soleal line. The soleus and two heads of gastrocnemius form the triceps surae. The triceps surae ending in the calcaneus, Achilles tendon, inserting to the calcaneus. The calcaneal tendon is strongest in the body. To the superficial layer belongs the plantaris muscle. The plantaris muscle starts above the lateral head of gastrocnemius, just above it, with muscle fibers. But soon afterwards, it forms a very long silver tendon that imitates a nerve. The plantaris tendon joins Achilles tendon, its medial aspect, and ends in the calcaneus. So what's the main function of superficial flexors in the leg? Their main function is to flex the foot plantary, so they act on the talocrural joint. Due to them, it's a very strong group, mostly gastrocnemius and soleus. They allow us to stand on our toes. They propel our body forwards. The deep group is composed of three muscles, or of four muscles, because the highest is the popliteus. The popliteus starts superiorly from the lateral meniscus and a groove on the lateral femoral condyle. It descends and passes medially and inserts onto the medial tibial condyle. It's the very first muscle to participate in flexion, in genuflexion, flexion of the knee. So we can say that it unlocks genuflexion. The three remaining muscles are very long and reach the foot, its planta, its sole. And the medial muscle is called flexor digitorum longus. It's very important to remember that the flexor digitorum longus starts medially, while the flexor hallucis longus starts laterally in the leg. So because of this, these two muscles cross each other. Their tendons cross each other, because the first position of the flexor digitorum longus is medial. So in the planta, it must assume its lateral position, and the flexor hallucis longus starts on the lateral side in the leg, but it's still destined to the great toe that's medial in position. Because of this, in the sole, two tendons cross each other. Flexor hallucis longus is more superficial. And this is the so-called plantar chiasm or plantar chiasma. So flexor digitorum longus is more superficial than the flexor hallucis longus. And the third muscle, deep flexor, the fourth one, is the tibialis posterior. The tibialis posterior, at the very beginning, is between flexor digitorum longus and flexor hallucis longus. But towards the distal part of the leg, it becomes the very first. It passes deep to the flexor digitorum longus, and just behind the medial malleolus is the very first muscle, tibialis anterior. It changes its position with reference to the flexor digitorum longus. Such a crossing is called the crural chiasma. So the crural chiasma refers to the flexor digitorum longus and tibialis posterior. In both chiasms, tendon of flexor digitorum longus is superficial in position. In both the crural chiasm and plantar chiasm. The flexor digitorum longus, after crossing tendon of flexor hallucis longus, it separates into 4 tendons that end on distal phalanges, like in the hand, and the flexor hallucis longus ends on the distal phalanx. What's the main function of all these muscles? They are responsible for plantar flexion of the talocrural joint. So as you can see, these muscles pass behind the fulcrum. The fulcrum is a transverse axis joining 2 malleoli, medial and lateral malleoli. And these 3 flexors are responsible for plantar flexion of the ankle joint. Apart from this, they act on the subtalar joint. In the subtalar joint, they are responsible for inversion. Inversion. What does it mean, inversion? They elevate the medial border of the foot. They elevate the foot medially. And this is accompanied by 2 other movements of the subtalar joint. So this is accompanied by adduction, and plantar flexion of the subtalar joint. So all these three muscles influence both ankle and subtalar joints. In both, they are responsible for plantar flexion. So in the ankle joint, only plantar flexion. In the subtalar joint, plantar flexion, adduction, and inversion, elevation of the medial border. And the fourth group refers to the two peroneal muscles, longest and brevis. Both pass behind the lateral malleolus. So, passing behind the lateral malleolus, they must flex. They are responsible for plantar flexion, like deep flexors, plantar flexion. And as you can see, the tendon of flexor of peroneus longus or fibularis longus passes behind the peroneal trochlea and ends on the tuberosity of metatarsal 5, while tendon of peroneus longus reaches the sole and ends on the medial side of the foot to the medial cuneiform and metatarsal cuneiform as well. So to the medial side of these two bones inserts the tibialis anterior. So you can see that the medial cuneiform and metatarsal 2 receive from the lateral side peroneus longus and from the medial side the tibialis anterior muscle. Apart from plantar flexion, peroneal muscles are responsible for eversion, so elevation of the lateral border of the foot. And this is accompanied by abduction and dorsal flexion. It's a very important thing that peroneal muscles, especially the peroneus longus, influence both ankle and subtalar joints. How do they act acting on the ankle joint? They are responsible for plantar flexion because they pass behind the fulcrum. So plantar flexion, acting on the subtalar joint, they are responsible for dorsal flexion. It's very important. Dorsal flexion, abduction, and eversion, elevation of the lateral border. In the foot, on the dorsal aspect, we have two short muscles, so both starting with and ending in the foot. The medial is extensor hallucis brevis, and the lateral extensor digitorum brevis. Their tendons join adjacent long tendons. So tendon of extensor hallucis brevis joins tendon of extensor hallucis longus. Tendons of extensor digitorum brevis join tendons of extensor digitorum longus. And in the foot, we have the same extensor hood on the dorsal aspect, like in the hand. And what's typical of it, that it's contributed by the lumbricals and interossei muscles. And like in the hand, lumbricals pass plantar to the deep transverse metatarsal ligament, and interossei muscles, both plantar and dorsal, pass dorsally. In the foot, we can distinguish three groups. Some muscles refer to the muscles of the great toe, the medial eminence, muscles of the small toe, and muscles of just plantar muscles. We can, in the foot, all these muscles may be separated into 4 layers. The superficial layer 1 includes only 3 muscles: abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. 3 muscles referring to the same layer: flexor digitorum brevis in the middle, flanked by abductor hallucis and abductor digiti minimi. Layer 2 consists of flexor digitorum longus, its tendon, to which quadratus planti inserts posteriorly, and 4 lumbricals. This is completely the same like in the hand. And 4 lumbricals contribute to the extensor hood. So layer 2 consists of the quadratus planti posteriorly, 4 lumbricals anteriorly, both to do with the flexor digitorum longus. Layer 3 consists of 3 muscles, and so this is flexor hallucis brevis with 2 heads, medial and lateral. Flexor digiti minimi, which is visible here, and between both adductor hallucis with its oblique and transverse heads. And layer 4 refers to interossei muscles arranged in 2 layers, plantar and dorsal. Like in the hand, we usually have 3 plantar interossei muscles. So this one is very atypical, anomalous. Oh, dorsal. So dorsal is good. So plantar, 2, 3 plantar interossei muscles, and 4 dorsal interosseous muscles. The main difference when compared to the hand is that all muscles are arranged with relation to digit 2, in the hand with relation to the middle finger. So that's all for today. Thank you for your attention and see you on Thursday.
Thank you, Professor.
Thank you, bye.